I've never played.
Say something about YouTube. You're gonna be on the YouTube.
No, don't want my face on it.
Now it is. It's too late. It's too late.
All right, now look. Here's the sphenoid. Remember the Selaturcica? Here it is. What's in there? What sits in there?
The pituitary.
Right, pituitary gland. So you can see the pituitary gland must be pretty darn important if it's in the middle of the skull and it's surrounded by even more bone in the middle of the skull. There must be something pretty important about that gland. But this is as if you took the sphenoid and pulled it out. Okay, so see those things hanging down? Look, that's them right there in the back of the jaws. You see that? Okay. Those are called the pterygoid processes. Right. Pterygoid processes. All right, so that's the sphenoid. It's in there like that. You have pterygoid processes. That's the bat feet. We have a medial and lateral pterygoid processes. The medial ones are towards closer to the palate, and the lateral ones are closer out toward the jaw.
Right in there.
Okay, y'all see that?
Yeah.
And these have chewing muscles attached to them. And if you really felt like it, you could stick your finger way back in the back of your mouth, and you could feel the chewing muscles, and you could actually feel the hardness of the bone back there.
And you can massage them too.
And you can massage them and they'll probably be kind of tender. Have you worked on them on people? Are you a massage therapist? Yeah, you can work on them to help people with jaw problems too. So,
Do you wear gloves for that?
Yes, you do
oh,
wear
okay,
gloves.
good.
yeah, you have to do it inside the mouth.
Yeah, you go in.
Yeah, do they bite you?
Okay, so now we've got the sphenoid bone down in there. So you see that there's wings. Okay, so they thought, hey, let's just call them the greater and lesser wings. So the small wings or the lesser wings are right up here. Okay, you see they're smaller. And the greater wings make up the fossa, the middle fossa. So those are the greater wings. See how they're bigger? Okay, then we have the clinoid processes. These are the anterior clinoid processes. And then on the posterior aspect of the Selaturcica, we have what's called the dorsum sellae. Remember, dorsum is posterior. And these little tips here are the posterior clinoid processes. And they're more prominent on this pull-out bone, posterior clinoid processes. Okay, is that it for this one? That is like got to be my favorite, one of my favorite bones. All right, in the Selaturcica, there's a little pit, and that comes from the bone growing around the pituitary gland, and the pituitary gland fits in that little pit, and the AKA for pituitary gland is the hypophyseal, and so that's also called the hypophyseal fossa. So it's another little pit, and that's where the little gland sits in that little pit inside. It's like the little dugout place in the saddle. Okay, now let's look at the let's look at the sphenoid back in the cranium, and we have the optic canal, which is right here. Can you guys see that optic canal? What do you think goes through there?
Optic nerve.
Right, optic nerve, and you can see the tip of the pointer here. So we've got one on each side. Yeah, right here, tip of the pointer. So the optic nerve, that's what takes visual stimuli and brings it to the brain.
You see it from the. Yep. Yeah.
Did you see it? Right there.
Right in.
It's like a horror flick.
Ah.
Okay, optic nerve. Or optic canal for the optic nerve. And then we have a superior orbital fissure here. We have one on each side. Superior orbital fissure. And then the inferior orbital fissure. Right here. And these are for some muscular attachments, pass through the tendons for extraocular muscles. Extra means the muscles on the outside of the eye.
Okay. I'm guessing
All right, we
superior
did
and
the
inferior. Okay.
medial. The medial, and we look in the posterior aspect of the skull, remember the pterygoid processes here. So the medial pterygoid process is on the inside and the lateral on the outside. You see that? Medial and lateral. Did y'all see that?
I'll look at that.
You can see it a lot better. Okay, let's look at the ethmoid. Okay, here we go.
Yeah, it's
Trying to figure out how that fits down in there.
I think that looks maybe.
That way,
Mm-hmm.
yeah.
Okay, whoops. All right, the ethmoid is, this is the ethmoid bone pulled out. The ethmoid bone is kind of like inside the nasal cavity in the frontal bone area. So this is all you can see on the skull right here. Actually, I think it goes in this way. Okay? So the ethmoid participates in both eye orbits and in the nasal cavity, and it houses the nasal mucosa, which is the organ for smell. Now you see all these little holes here? Actually, I think it goes this way. I have to put it back on the exploded skull because I'm having a hard time getting oriented to the way it fits in here. Anyway, you see all these little holes here? Okay, these are up in the roof of the nasal cavity. And those little holes are, what passes through all those little holes are tiny little nerve receptors like you had in your skin, but these are specialized for smells. And they combine together and they make the olfactory nerve that goes to your brain, and then you smell things. And then the other job it has is making up the upper part of the bony nasal septum. So in the ethmoid, we have the perpendicular plate, and that's the superior part of the bony nasal septum. So that's right here, perpendicular plate. Then we have the crista galli, and the crista galli is the thing that has all the little holes in it. No, wait a minute. No, the crista galli is this thing here in the middle, this part of the bone in the middle. The thing with all the holes in it is called the horizontal or cribriform plate. Okay, and then the middle nasal concha are those right there. And when you have part 2, you'll learn what those are for. Middle nasal concha.
Oh, those are the. Yeah.
on the top.
Yeah, they're
Those
at the top.
guys.
So you do have superior nasal concha, but you can't see them on here.
Makes me want to sneeze.
Okay.
It does, doesn't it?
Okay. All right. Next time we'll go over the facial bones. So that's your cranial bones.
Yay,
next time.
cranial bones.